Hey guys, this is Dr. Cameron Dennis, physical therapist with Back on Track Therapy and Wellness. And today I'm getting on to talk about back pain. So I've been doing a back pain series which has included different types of back pain and explanations as to how you can get these types of pain. So if you haven't seen those videos, I can link those below. But this video is going to be more specifically about how to treat or how to attempt to self-treat your own back pain. So what we know from science and scientific research is that most of the time people with back pain will not need back surgery in order to get better. So that means that it is either getting better on its own with time, they're getting physical therapy, which is helping, or they're seeing a chiropractor and that's helping. We know that back surgeries, just by their very nature, can be are clearly more invasive than conservative treatments such as physical therapy and chiropractic, therefore taking longer to recover, just due to their more invasive nature, as well as physical therapy having similar outcomes, similar or better outcomes than spinal fusions for relief of back pain. So if you could get rid of your back pain with exercise in 6 to 8 weeks or potentially less, why wouldn't you, right? So there's a couple things I want you to try. Some people's back pain feels worse when they're sitting. Other people's back pain feels worse when they're standing. There are people that fall kind of in between these two extremes, but in general, there's pain that gets worse when you sit, and pain that gets worse when you stand. Okay, so the pain that gets worse when you sit, people that are sitting constantly at work, I want you to try these exercises. Okay, so the first exercise is going to stretch out the front of the hips here. It's going to bring you into a little bit of lumbar and thoracic extension. Okay, so you can do this on the floor, and what you're going to do is this pose here. Okay, you can either do starting from here on your elbows if you can't tolerate coming all the way up. If this position is hard for you, you might even start off here, okay, just laying flat. Okay, once you can tolerate that for several minutes, then you can try coming up on your elbows. Once you're able to tolerate that, then you can come up here, okay? So you can either do it repeatedly, or you can maintain that position for, like I said, several minutes, okay? And as I said before, that's going to be more for the people who are sitting down a lot during the day. They need that stretch to kind of open their body up a little bit. More than just the stretch, though, they need to get that variation in their movement to help retrain their body. Okay, so for those that have more pain when standing, these are the types of people that stand a lot at work. They might stand with a posture similar to this. You'll notice that they kind of stand like that, and so you notice this excessive little curve here. What we know is that there are certain stretches that help with that as well. So this is going to be more of a reaching forward type of stretch. Hopefully you can see that. So you're reaching forward, reaching off to the side slightly, and then off to the other side. Okay, so from here you can see I'm stretching out my lumbar spine right here. Okay, like I said, you can either do repeated, okay, or you can maintain that position for about a minute or so, and you're going to make sure you go to each side as well. Okay, when you reach off to the right side, you'll notice that you'll feel it more on the left side of your back. You'll feel it on the opposite side. Okay, So that's specifically for pain in the lower back. If these stretches do not help you with your back pain after doing them potentially several days or several weeks, and this is more of the chronic type back pain that we're talking about, if these simple stretches don't seem to help, what I want you to do is reach out to your physical therapist, okay, because they are trained, specifically trained through physical therapy school to treat chronic back pain, okay? And like I said, physical therapy and conservative treatment is scientifically proven to have similar outcomes as back surgery. So don't skip right to back surgery just because your back has been hurting for a long time. Okay, give physical therapy a try. If you live nearby the Wapakoneta area, please feel free to reach out to me, and I'd love to help you with your back pain. Okay, if you've had an MRI in the past that has said you have herniated disc, degenerative disc, pinched nerves, you name it, that doesn't necessarily mean that you need surgery, okay? So give physical therapy a try, even though you might have what these people, what the surgeons, what the orthopedic surgeons are saying requires surgery. The science simply does not back that up for most people. So once again, this is Dr. Cameron Dennis, physical therapist with Back on Track Therapy and Wellness. And hopefully you found this video helpful. If you do, make sure to drop a like. If you have any comments, please sure to add those. And share this with anyone that you feel might benefit. So thank you for watching.